Yeah, yeah. And so it's really about, and again, if we move away from eyes and talk about vision, I mean, you basically, our eyes are tools that our brain uses to
Mm.
understand the world. And so it's really the brain learning how to move the eyes and how to interpret the information. And one of the first common critical points that we look at is by 6 months old, an infant has started to really organize how the two eyes work together. So you're wanting to check that they've hit that first developmental milestone, that there's no sign of what they call an infantile strabismus. And again, we're talking about a few percent of do that, but you still want to check. You may want to get a sense, particularly if there's a family history of eye turns or high prescriptions. That's a good time to start getting a sense of are these kids in where do they sit on the normal range? And at that age, there is a very, very broad range. So you're looking for sort of overall global signs that they're using the two eyes together, and that they're able to shift their focus, and everything's kind of looking healthy at that stage. So it's kind of a first marker. And certainly if there's a family history of high prescriptions from an early age, or a family history of eye turns or lazy eyes or eye surgery, in someone's grandparent had an eye surgery when they were little, then I would be saying, look, you probably that marks you as someone where having a general checkups are probably a good idea at 6 months old to get that first kind of bar set. Um, then the next phase is around the 2 to 4 year old age group, where they're starting to be more mobile. They're getting more control over being able to separate their eyes from their head and body movements,
Mm.
starting to pay attention to sort of finer detail. And you're able to get sometimes in that age, almost an adult test done, that, if you're using the appropriate kids symbol chart rather than letters, you can quite often
Mm.
get a fairly good complete visual exam done.
Mm.
But you're starting to look at that more finesse in how they're using the two eyes together. You may even start, when they're getting at that 4 year old end, start looking at visual processing. Are they starting to interpret things at an age expected level? Because you're starting to get into that pre-literacy kind of skills that you're looking for. Um, and again, looking for any um, sort of deviations from normal visual development that the kid might not outwardly show. And then you move on to your real getting into your pre your school readiness kind of testing, and that's where we more heavily look at focusing, eye teaming, visual processing. And so we really want that happening around that sort of prep, grade one kind of marker. And then it depends on the child's progress through school. If there's any concerns about how they're progressing, you may want to get them checked sort of annually, particularly if there's a family history of some issues. But after that point, then probably a couple of years later, you want to be looking into. Um, we tend to loosely break them up into what are the learning how to read skills,
Mm.
and then there's using reading for learning skills. So when the kids are entering late grade two, grade three, there's a change in what's expected of them reading. Okay, so
Mm.
they're transitioning from learning how to decode words to then starting to actually extract a lot more meaning from what they've read. So the print size gets smaller, the amount of work that they have to read gets bigger, and they're having to comprehend a lot more. And so that places a lot more demand on finer eye teaming and focusing skills. And so we're starting to look out for those common binocular visual dysfunctions and accommodation dysfunctions, which is the sort of technical words for eye teaming and focusing issues. I was going to
That,
say, and then after that, it's you want to patch in every couple of years because things change, and then you're also starting to look for signs of myopia development, and again,
yeah.
that's when you start to lose your distance vision, and that's particularly important. It used to be that if you had a family history, obviously that uh, predisposes you even more, but it tends to be a modern life problem. And I think we discussed last time that
Yeah.
the prevalence is really increasing in that one as well. So,
Yeah.
it loosely comes around every 2 to 3 years. Is what you want to be looking at.
Right. So just to clarify, like what age is a good age to
Yeah.
be thinking about myopia control? Is it like 5, 6 around there, or a little even earlier?
Yeah, look, it's a changing feast, and it depends on your demographics sometime, but certainly as old is where you get your first marker of being able to understand the likely risk of a particular individual maybe progressing towards some myopia. So we look at their family history, we look at what sort of activities they're into, how much time they're spending outdoors, and we're able to get also an idea from what their current level of prescription is. So even if they're not short-sighted yet, there can be sometimes some signs that they might be moving in that direction, and be able to counsel the family on how often we need to check them. It might become more regularly, and what sort of activities they and changes to their lifestyle that they should be looking at doing as a safety valve.